Hello, my name is Dr. Eleanor McCants-Katz, and I'm the Assistant Secretary for Mental Health and Substance Use. Today I'm pleased to present to you the results of the 2019 National Survey on Drug Use and Health. The National Survey on Drug Use and Health is a household survey that asks Americans about their substance use disorders, their mental health, and whether or not they received treatment services for these disorders. The National Survey on Drug Use and Health, or NSDUH, is collected by face-to-face field interviewers who talk to people about these issues, but for more sensitive questions, they give people a computer-assisted self-interviewing tool. The NSDUH covers civilian populations that are not institutionalized, so that includes households, college dorms, homeless living in shelters, and civilians on military bases. But it's not a complete survey in that it does not include active duty military, people who are living in hospitals long-term, prison populations, and the homeless who are not sheltered. And we know that some of these individuals have fairly high rates of substance use disorders and mental disorders. So the National Survey on Drug Use and Health tells us about American households. The sample includes people from all 50 states and the District of Columbia, and every year about 67,500 people are interviewed. The data is collected from January to December. So from January to December of 2019, we collected this data. And then over the course of 2020, it's now August, we are analyzing this data to get to the point where I can tell you about it today. So how do we use NSDUH? NSDUH provides us a window, if you will, into the state of substance use and mental health issues in the United States. It helps in guiding federal policy directions, addressing problem substances, the prevalence of mental illness, the intersection of substance use and mental health issues, and the NSDUH provides insights that can be looked at in the context of data and surveillance from other federal agencies to put together a larger picture that helps in decision-making in other departments about what types of resources might be needed and where resources should be directed related to mental and substance use issues for the American people. This is a slide that gives an overview of mental illness and substance use disorders in America in 2019 for people that are 18 years of age and older. And what it tells us is that 51.5 million Americans, that's 20.6% of adults in our country, met diagnostic criteria for a mental illness in 2019. 25% of them, over 13 million Americans, met diagnostic criteria for a serious mental illness. That's a mental illness of a severity that it impacts the ability of those folks to live their lives without interference from mental disorder. We also know that over 19 million Americans met diagnostic criteria for a substance use disorder. That's 7.7% of adults in our country. And of those, most had alcohol use issues, about 73%. 38% struggled with illicit drugs, and 11.5% had both illicit drug use problems and alcohol problems. And we also look at co-occurring disorders, which occur frequently in our country. Over 9 million Americans met diagnostic criteria for both a mental illness and a substance use disorder. In 2019, 61.2 million Americans had a mental illness and or a substance use disorder. This is an increase of nearly 6% over 2018, and that increase is composed entirely of increases in mental illness in Americans. I'll talk about alcohol use and then go on to talk about illicit drug use. As you can see in this slide, what we're looking at are the years 2016 to 2019, so over the last 4 years. And I like to show you the data by age group. So we have 12 to 17-year-olds, 18 to 25-year-old young adults, and adults 26 and older. In terms of alcohol use, We see that in 18 to 25-year-olds, there has been a significant decline in alcohol use relative to the data that we collected in 2016 and 2017. The data has stayed fairly stable for younger adolescents and for adults 26 and older. If we look at alcohol use disorder, those are disorders related to the overuse and excessive use of alcohol. What we see, again, is a significant decline in alcohol use disorder in our young adults relative to 2016 data. And again, the numbers for adolescents and older adults have been very stable over the last 4 years. To summarize, past month alcohol use and past year alcohol use disorder remained stable in age groups from 2018 to 2019. Alcohol use and alcohol use disorder declined significantly in young adults from 2016 to 2019. So at SAMHSA, we think this is evidence for the success of our prevention programs, and we're going to continue our prevention programs. In 2018, SAMHSA funded the Substance Abuse Prevention Technology Transfer Centers. And those centers produce resources and other materials that are circulated in communities to people to inform them about the risks of alcohol use and to prevent alcohol misuse. We also use those technology transfer centers as training sites to inform clinicians about the risks of alcohol use, particularly underage alcohol use. Our Center for Substance Abuse Prevention has a program called Talk They Hear You that focuses on underage drinking, and the Center for Substance Abuse Prevention also requires its Partnerships for Success grantees to emphasize underage drinking prevention. The Center for Substance Abuse Treatment has promoted SBIRT, which is Screening, Brief Intervention, and Referral to Treatment for alcohol use in all of its programs, its grant programs. That includes our criminal justice programs, our programs that reach out to pregnant and postpartum women, and adolescents, as well as our programs that are directed towards HIV and homeless populations. The Center for Substance Abuse Treatment has also funded training on screening, brief intervention, and referral to treatment in medical residencies and other healthcare practitioner programs, so that we now have helped to establish the screening for hazardous alcohol use and alcohol use disorders in many medical settings. This figure shows illicit drug use for 2019 in the United States. And what you see here is that we have several areas that continue to be concerns that I'll talk more about over the next few minutes. They include opioids, marijuana, and methamphetamine primarily. But what you see in this figure is that by far and away, marijuana is the most used of the illicit substances. 48.2 million Americans tell us that they are using marijuana currently. That's 17.5% of Americans 12 and older. And this is a significant increase from what we saw in 2018, where 15.9% of Americans said they were using marijuana. We see fairly steady numbers in terms of psychotherapeutic drug use. This is inclusive of opioids. We see hallucinogen use at about 6 million, cocaine at 5.5 million, inhalants at just over 2 million users, methamphetamine at just over 2 million users, and heroin users at 745,000. I want to talk about the opioid epidemic because this is an area that we have made major investments at a federal level, at the state and local levels as well. And this is really the highlight of the data that I'm going to show you today, because we've seen substantial progress on the opioid epidemic in terms of prescription pain reliever misuse and heroin misuse. At present time, in 2019, 10.1 million people are opioid misusers. That's about 3.7% of Americans 12 and older. 9.7 million of these folks are misusers of prescription pain relievers, far exceeding the number of heroin users in the United States. And it really speaks to the need to continue to focus on the appropriate use of prescription pain relievers in our country. In terms of the most misused pain relievers, we see that is led by hydrocodone, followed by oxycodone. We see modest declines overall for each opioid category, with the exception of prescribed fentanyl, where the numbers have not changed substantially from 2018. We have 745,000 heroin users and 404,000 people who tell us that they are misusers of both prescription pain relievers and heroin. But when we look at opioid misuse by years, again, this is 2016 to 2019, and when we look by age groups, we see very positive results. For our adolescents, we see continued significant declines in opioid misuse. For 18 to 25-year-olds, this is true as well as for adults that are 26 and older, which translates into an overall significant decline in opioid misuse in 2019 relative to the years of 2016 and 2017, when we had seen quite large increases in use, and which led to the investment by the federal government in the prevention, treatment, and recovery services that have led to some of the results I'm showing you related to opioids. As you remember, 2017 was the first year of the 21st Century Cures Act, which gave us the initial $500 million a year that went to the states to help them to address their opioids problems. And then Congress and the President agreed on an additional $1 billion, which has been maintained to the present time. And we are now seeing the results of those great investments into addressing opioid use issues for Americans. So when we look more closely at prescription pain reliever misuse and heroin use, what I'm showing you here on the upper part of this slide are figures that explain where we're at with prescription pain reliever misuse in the United States, and on the lower part of the slide, heroin use. What you see here is that prescription pain reliever misuse has significantly declined from 2016 to the present 2019 data, going from 11.5 million misusers of prescription opioids to 9.7 million in 2019. Again, we see a significant decline in pain reliever use disorders, going from 1.8 million in 2016 to 1.4 million in 2019. And new misusers of prescription pain relievers also have dropped from over 2 million in 2016 to 1.6 million in 2019. When we look at heroin use, what we see is a steady decline in heroin use from 2016 forward. We see also significant decreases in heroin use disorder in 2019 relative to 2016 and 2017. And we are very pleased to see that new misusers of heroin have dropped substantially from the 2018 data. This is very important because heroin is a source of synthetic opioids that are quite potent, such as fentanyl, carfentanil, and other types of opioids that often are mixed with heroin and lead to overdose and death. So we're very pleased to see this dramatic drop in new misusers of heroin. When we look at pain reliever misuse and look by age group, what we see is that there is a substantial decrease in prescription pain reliever misuse by adolescents. That's very good news and speaks to the great work that preventionists across this country have taken to assist adolescents with learning about the dangers of misuse of these kinds of drugs. We also see a significant drop in prescription pain reliever misuse in our 18 to 25-year-olds compared to the numbers that we saw in 2016 and 2017. And the same is true for adults 26 and older. So this is all very good news. But I do think it's worth, again, pressing the point, and I've shown this data each year that I've done the NSDUH presentation. I've shown this data that has been collected by SAMHSA since 2006, and what this shows is when people answer a question about pain reliever misuse affirmatively, they are asked, where do you get these pain relievers that you tell us you're misusing? And what this shows is that nearly 51% of people who are misusing prescription pain relievers got them free from friends and relatives, bought them from friends and relatives, or stole them from friends and relatives. But the majority got them free from their friends and relatives. There's also nearly 38% of misusers who tell us that they are misusing these medications. They are not using them always the way their doctor or other healthcare provider prescribed them. Nearly 38% of people endorse that. This is important information because we also know that nearly 84% of the people that are sharing or selling these medications are getting them from a single prescriber. What this tells us is that we really need to continue to focus on educating Americans about the dangers of misuse of prescription pain relievers. These medications can have significant adverse effects. They can lead to addiction, and often people don't know that when they are using these medications. So it's important that Americans understand that, and it's important that people who are prescribed these medications are given education about the risks that are involved with giving or sharing these medications with people for whom they're not prescribed. It also underscores the need to continue to educate prescribers on judicious use of these medications and the need to assess carefully how much medication does an individual need. When we see data that tells us that such a large number of people are able to give away or sell medication, people are being overprescribed, and that contributes to risk for overdose, death, and addiction. When we look at misuse of prescription opioid subtypes, we see that the two opioids that are most misused are buprenorphine and methadone. This is important because buprenorphine is a medication that is primarily used for the treatment of opioid use disorder. It's important that if people need this medication, that they get to a treatment provider so that they can safely be prescribed these medications and can have their opioid use disorder addressed in a healthy way. In terms of methadone, a couple of important things. One, this is methadone that is prescribed methadone. It is not methadone coming from opioid treatment programs. It's important for people to understand that methadone is a drug that can be quite dangerous when taken by people who have not been prescribed the medication. It has very long-acting effects. It accumulates if you take it repeatedly, and if you don't have tolerance to opioids, methadone can be deadly. So it's very important that we understand that there is still substantial misuse of these prescription opioid medications, and that we educate our people about the safe use of these medications. Now, if we look at heroin use, we continue to see very good news in terms of decline in heroin use by young adults. You can see that there has been very significant drops in the numbers of 18 to 25-year-olds using heroin. That is every year since 2016 forward, and we're very pleased about that because this has been a group that we are trying very hard to reach and to get them resources that they need to protect them from opioid use disorders and to help them should an opioid use disorder develop. If we look at heroin-related opioid use disorders, again, in our 18 to 25-year-olds, we are seeing significant decreases in the numbers of people in that age group that have developed an opioid use disorder related to heroin use. Again, very good news and speaks to the important work being done in our states and our communities to address opioid use disorder in our people. And if we look at opioid use disorder overall, and this would be opioid use disorder related to misuse of prescription pain medications and heroin. Again, if we look by age group, we see significant declines in opioid use disorder in adolescents, young adults, and adults 26 and older. So again, these are the very positive findings from the National Survey on Drug Use and Health. I think it's very important because it shows that when we put resources into a major national public health problem, we can make a very positive impact. We need to be doing that in other circumstances that relate to behavioral health as well. And I'm going to show you that data in the next few minutes. We've also seen treatment gains in the number of people that are receiving medications to treat their opioid use disorder, sometimes called medication-assisted treatment or MAT. These are FDA-approved medications for the treatment of opioid use disorder. They include two opioids, methadone and buprenorphine, and the opioid antagonist injectable naltrexone. One of the things that was very important to me in coming here in 2017 was to make sure that Americans with opioid use disorder had access to the gold standard for the treatment of opioid use disorder, which is medication to treat these conditions or medication-assisted treatment. And what you see here is from 2016 forward, we see a large increase in the number of people that are receiving medications. There are increases for all of the FDA-approved medications in terms of their use across the nation for people with opioid use disorder, so that we now can tell you that in 2019 we had over 1.46 million Americans access medication to treat their opioid use disorder. I want to summarize opioid misuse in our country. We have seen a significant decrease in the number of Americans living with opioid use disorder. We had 2 million Americans with opioid use disorder in 2018. That has dropped to 1.6 million in 2019. And as I just showed you, a large number of them are accessing medication-assisted treatment. In addition to their medications, they are also getting psychosocial services and community recovery supports, and these together have helped to make that positive impact on the opioids crisis. Among our people that are 12 and older, opioid misuse decreased significantly from 2017, and for people 12 to 17, opioid misuse decreased significantly from 2018. Pain reliever misuse decreased significantly from 2018 for adolescents and continues trending downward for young adults. Heroin initiation decreased significantly. We saw a 57% decline in new users of heroin from 2018 to 2019. Heroin use among young adults decreased significantly from 2018. But I do have to say that despite the gains that I've been able to show you, one of the things that we've learned very recently from CDC is that, unfortunately, we have seen an increase in opioid overdose deaths in 2019. It appears that there is a 4.6% increase in opioid overdose deaths, and this underscores the risks to Americans that are opioid misusers of potent, illicit synthetic opioids such as fentanyl that continue to kill our people by the tens of thousands. It's very important that we continue the resources to address opioid use disorder, and that we do the outreach necessary to help people who may be reticent to come to treatment on their own, that we make use of community resources, of our peers, and of our clinicians to help those folks and to stop the continuation of opioid overdose deaths. And buprenorphine continues to be the opioid with the highest percentage of users who acknowledge misuse of the medication. Again, this is a medication that we want to see used appropriately. It's an important part of the treatment of opioid use disorder, and it's important that as leaders in our communities and in our field, that we work to make people aware of the availability of treatment and the risk that can be associated with using medications outside of a treatment program that is tailored to the individual. Now I want to talk for a few minutes about other illicit substances in our country and what NSDUH has shown us in 2019. I'm going to spend some time talking about marijuana. Marijuana, as I mentioned earlier, is the most misused of the illicit substances in our country. And what you see here is that if we look at the last 4 years, 2016 to 2019, we see increasing past month marijuana use for all age groups, adolescents, young adults, and a significant increase in past month marijuana use in adults 26 and older. When we look at young adults, 18 to 25-year-olds, again, we see significant increases relative to 2016 in terms of marijuana use on a monthly basis. And for people that are frequent users, daily or almost daily use, again, we see a significant increase in the number of Americans that are daily or near daily users relative to 2016. When we look at adults that are 26 and older, again, we see each year from 2016 forward significant increases in users of marijuana and significant increases in heavy users of marijuana, those people that are using daily. And when we look at our 12 to 17-year-olds, our adolescents, again, we are seeing significant increases in marijuana use disorder. This is very concerning because it speaks to the severity of the problem for our teenagers. And for the last couple of years, I've talked about substance use among pregnant women. I want to say a little bit today as well. Looking at this data, again, we're looking at the years 2016 to 2019, and what you see is a modest increase in illicit drug use in pregnancy. We see significant declines in the use of tobacco products, and we see declines in alcohol use by pregnant women. When we look at the information on illicit drug use by pregnant women, what we see is that the increase, the uptick in illicit drug use by pregnant women is entirely related to their marijuana use. And when we look at women at large, women who are pregnant, and compare them to women who are not pregnant but who are of childbearing potential, so these are women aged 15 to 44, what you see is, again, a modest uptick in marijuana use by women who are pregnant, but you see a significant increase year over year, 2016 to 2019, significant increases in marijuana use by women who are not pregnant, but who are of childbearing potential. And when we look at daily or near daily use of marijuana by women looking at pregnancy status, again, we see a modest uptick in women who are pregnant that are using marijuana daily or near daily. But again, we see significant increases in heavy marijuana use by women who are not pregnant year over year from 2016 to 2019. And one of the things that is very concerning is when I started to look at this data in some detail and saw the issues around marijuana use in pregnancy, one of my questions was, what other risks are there for these pregnant women? And we looked at their use of other substances as well as their mental health condition. And what this slide shows you is that pregnant women who use marijuana are far more likely to be cocaine users, hallucinogen users, stimulant users, users of benzodiazepines, sedating, tranquilizing drugs, opioids. They are far more likely to be alcohol users, to use alcohol in a binge fashion, and very unfortunately, they are more likely to have problems with serious mental illness, major depression, and suicidality. Women who are using marijuana really need a good evaluation to determine if they are having these kinds of problems. It's really very important for the mom's health and the baby's health, and it's important that we talk to women about how we can best help them to maintain their health, not only while they're pregnant, but throughout their lives. But it's really very concerning to find that pregnant women who are marijuana users are at risk for these other types of problems at much higher rates than women who are not marijuana users and are pregnant. So why do I focus so much on marijuana use? I think marijuana is something that many of you who've heard me speak a number of times know that I speak about it quite a lot. And I do that because there are a lot of health concerns with marijuana. And these health concerns seem to be drowned out by a multi-billion-dollar industry that will tell people that marijuana is pretty much harmless and good for anything that ails you. It simply isn't true, and you don't have to take my word for it. What I've done in this slide is to summarize some of the recent data, but this is not exhaustive. You could find many more research articles that would identify major health concerns associated with marijuana use, but here are a few of them. Use during pregnancy may be associated with fetal growth restriction, stillbirth, preterm birth, and these infants are more likely to need an admission to the neonatal intensive care unit. Marijuana use has been linked to depression and suicide in adolescents, as well as in our veterans. Use in adolescence has been associated with an increased risk for psychotic disorders in adulthood and has been linked to suicidal ideation and suicidal behaviors. The risk for psychotic disorders by marijuana users that are adolescent increases with the frequency of their use, the potency of the marijuana, and as the age of first use decreases. So the earlier in life a person starts to use marijuana, and the greater the frequency and the potency of the drug, the higher their risk for the development of a serious mental illness, such as a psychotic disorder. This information, by the way, comes from the National Academy of Medicine, who did a very extensive report on health concerns associated with marijuana use. I recommend that to anybody that wants to learn more about this. We also know that among heavy users of marijuana who are adolescents, there has been a link to a decline in IQ that may not reverse even if marijuana is stopped later in life. And marijuana use has been associated with young people not attaining their educational goals and dropping out of school. Marijuana use has been linked to the development of other drug use disorders, alcohol use disorders, tobacco use, and other illicit drugs. Marijuana intoxication is an important cause of motor vehicle accidents, and these motor vehicle accidents have been associated with serious injury and death. It really is wrong to say that marijuana use never killed anyone, which is something I've heard said by proponents of this drug. Simply is not true. And the association that has been described quite a lot between state laws that liberally allow medical marijuana and opioid overdose mortality reversed direction. It had been reported that from the years 1999 to 2010, there was a 21% drop in opioid overdose mortality in states with more liberal medical marijuana laws. That changed. And in 2019, Shover and colleagues published a study showing that, looking at the years from 1999 to 2017, there was actually a 23% increase in opioid overdose mortality in states that have liberal medical marijuana laws. And there is also a risk of subsequent prescription opioid misuse and the development of opioid use disorders in people who reported marijuana use. So these are substantial health concerns. Marijuana is not the same drug that it was a generation ago. The THC content is much, much higher now, and often people use not only marijuana that is smokable, but they may add other types of marijuana products. And this can give very, very high doses of THC to people. It's just not comparable to what people from older generations may have experienced. And it's important that we get this information out so that Americans can think this through and decide for themselves what's best for their health. But they need to have all the information. And my concern is that they don't have all the information right now, and I only need to look at the NSDUH data to see the high rates of use to know that. I'm going to move on now to cocaine use. And what you see here, again, looking by age group, over the years 2016 to 2019, we see a decline in cocaine use in young adults relative to 2017, steady numbers in adults 26 and older. When we look at methamphetamine, again, the numbers show a decrease in young adults relative to 2017, but what we see for adults 26 and older is a significant increase in the number of methamphetamine users both in 2018, and that continues in 2019. This is important because methamphetamine is not evenly distributed throughout the United States. There are a number of states in the West, in the Midwest, Alaska, Hawaii, that have much higher rates of methamphetamine use. And these numbers are very worrisome in terms of the increases that we're seeing in adult use of this drug. When we look at prescription stimulants, we see a positive finding here in that prescription stimulants, mainly used for the treatment of attention deficit hyperactivity disorder, have dropped. Misuse has dropped in young adults 18 to 25 years old. When we look at hallucinogen use, LSD use among all age groups, it is worrisome that we are seeing significant increases in LSD use in adolescents and in adults 26 and older. To summarize, past month marijuana use and past year daily or almost daily marijuana use significantly increased in adults who are 26 or older. Past year marijuana use disorders significantly increased in teenagers. We saw non-significant increases in marijuana use by pregnant women, with significant increases in marijuana use by women of childbearing potential aged 15 to 44. Alcohol and tobacco use is trending downward in pregnant women, but it's worth saying that any alcohol or tobacco use can be hazardous in pregnancy. We're pleased to see those numbers trending downward, but we want to make sure that women who are pregnant understand that there can be health risks for their babies with alcohol and tobacco use. We saw no significant changes in cocaine use in all age group, but we see an upward trend in methamphetamine use with significant increases from what we saw in 2016 and 2017 in adults 26 and older. And we saw prescription stimulant misuse trending downward in 18 to 25-year-olds, with past year LSD use significantly increased in adolescents and non-significant increases in LSD use in young adults and adults. Now I'm going to spend some time talking about polysubstance use and mental illness because these disorders co-occur quite frequently. Here I'm showing you alcohol use and its relationship to the use of other substances, as well as its relationship to serious mental illness and major depression. What you see here in the red bars are individuals who have no past month use of alcohol. In the blue bar, people who have current use of alcohol but no heavy use, and the green, people who are heavy alcohol users. And what you see is that the use of marijuana, opioids, cocaine, methamphetamine, and major depression, as well as serious mental illness, are all increased in people who have heavy alcohol use. And this is really very important because it speaks to the frequency of people who use one substance often being exposed to and using other substances that can be quite harmful. If we look at marijuana, we see basically the same thing. In this slide, what I'm showing you, again in the red bar, people who do not use marijuana versus those who use marijuana at all, and those who use marijuana daily or nearly daily. And what you see here is that there are significant increased numbers of people who are marijuana users, with the highest rates being seen in daily or near daily marijuana users who also misuse opioids, use alcohol heavily, use cocaine and methamphetamine, and again, have higher rates of major depression and serious mental illness. This slide shows a table comparing national numbers to numbers in a state that has liberal marijuana laws. And I show this because I think this is predictive of where we're going in this country as states continue to liberalize their marijuana laws. I don't mean to pick on Colorado, but Colorado is the state that has had some of the most liberal marijuana laws and has had recreational marijuana available for a number of years as well. What you see here is that in young adults, 18 to 25 years old, you see much higher rates of marijuana use in Coloradans than the national average. These numbers are quite statistically significant. When you look at daily marijuana use, and this would be heavy marijuana use, you see a full doubling of the numbers of 18 to 25-year-olds who are daily users of marijuana compared to the national average. When we look at past month marijuana use in adults that are 26 and older, again in Colorado, nearly 19% of Coloradans are users of marijuana compared to 10% nationwide. When we look at co-occurring substance use disorders in adults, we see that this is also much higher in Colorado. Same for co-occurring substance use disorder and serious mental illness. Again, those co-occurring disorders are higher for individuals in Colorado versus the national average. So this is data that I think is worth considering as states liberalize laws for a drug that is far more potent than it was even a few years ago, that definitely has addictive potential, that definitely has health effects. We can expect to see higher rates of polysubstance use and co-occurring substance use disorders and serious mental illness. If we look at opioid misuse and its relationship to other substance use and mental illness, we see the same thing. Red bars being people who do not misuse opioids, blue bars, people who do. And you can see that the rates of misuse of other substances and mental illness are much higher. The same is true for methamphetamine. And so the reason I'm showing this data is to really underscore the point that polysubstance use is quite common. And if a person is having problems with one substance, it's likely that they are using and maybe having problems with other substances. It's important to understand this because treatment providers really need to be screening for and treating all substance use disorders and problem substance use. Treating one substance use disorder will not treat other substance use disorders. We also know that the association of substance misuse and mental illness is strong, and so we have to do a better job of helping Americans understand these relationships and the risks that are conferred with the use of substances. That it's usually not just one substance, and the risk for mental illness is substantial as well. Now I'm going to switch to talking about mental health issues that are brought forward by the National Survey on Drug Use and Health. I will show you data that I believe to be quite concerning. And the first is a slide showing that serious mental illness is increasing in our country. This is a graph showing data from 2008 to 2019. What you see is a rather steep upward trajectory from 2016 forward in the rates of serious mental illness in our young adults, 18 to 25-year-olds. We see similar findings for adults 26 to 49 years old. And what is really quite concerning is that over 43% of these young adults with serious mental illness in 2019 received no treatment. And for those adults that are 26 to 49 years old, nearly 35% of them with serious mental illness got no treatment. So this is very concerning because serious mental illness is a condition that is going to impact a person's life. So it's important that we do more to help Americans that are living with these conditions. When we look at major depressive episodes, we see that for people 50 years of age and younger, the rates of major depression are increasing, and they are increasing quite significantly. What I'm showing you here again is data over 4 years by age group, and you can see that the rates of major depression have increased substantially in adolescents, in young adults, and in adults 26 to 49 years old. When we look at major depression that also has caused severe impairment so that people cannot complete the normal aspects of their day-to-day life because of that major depression they're experiencing, what we see is that if we divide the data by gender, males and females, men and women, what we see is in our adolescents, we see significant increases in major depression with severe impairment for males and females, but the rates are higher in young women. We see the same thing in young adults, 18 to 25-year-old people. Women in this group have significantly greater rates of major depression with severe impairment, but men also experience the same condition, and these numbers are going up substantially. In adults that are 26 years of age and older, again, we are seeing increases both in men and women in the rates of major depression that causes severe impairment. And major depression, as well as other types of situations, can be related to suicidality. What I'm showing you here is data from the National Survey on Drug Use and Health, looking at young adults, 18 to 25-year-olds, and adults 26 to 49 years old, and suicidal thoughts, plans, and attempts. And what you see is that over a 10-year span, looking at 2009 with the blue bars, 2019 with the green bars, you see this large increase in serious thoughts of suicide, people making plans to end their lives and attempting to end their lives, young adults in the prime of life. We see similar findings in adults 26 to 49 years old. Again, significant increases in serious thoughts and making plans for suicide. We know that suicide is one of the top 10 causes of death in this country at this point, and this is an important finding and one that we need to consider in our care and treatment of Americans who have substance use issues and mental health issues. Now I want to move on to talk about co-occurring mental and substance use disorders. Again, co-occurring is quite common, and the impact on the lives of Americans is quite substantial. This is showing substance use among adolescents, 12 to 17, by whether or not they had major depression. And what you see here is that in the red bar, those are adolescents that did not have major depression. The blue bars are adolescents that had a diagnosis of major depression in 2019, and you see quite significant increases in illicit drug use, including marijuana, opioids, binge alcohol use, and cigarette use in those adolescents that have major depression. So there is a strong relationship between major depression and the misuse of substances. Very important that when we see an adolescent with major depression, that we screen for and treat when illicit drug use and other substance use is found to be a problem. When we look at co-occurring substance use disorder and mental illness in adults, what I'm showing you here are age groups 18 to 25, 26 to 49, and those that are 50 and older. And what you see is that in adults that are younger than age 50, we are seeing significant increases in co-occurring substance use disorder with mental illness. And this translates into a significant increase for adults 18 and older relative to the findings of 2016 and 2017. So co-occurring substance use disorders are increasing, and they are increasing significantly in those with mental illness. When we look at co-occurring issues, substance use and mental illness among adults, here's what we see. I've divided this out for you so that you can look at it by individuals with no mental illness, that's the blue bar, people who've had any mental illness, that's the orange bar, and people with serious mental illness, that's the red bar. And what you see is that illicit drug use, and specifically marijuana, opioid, binge alcohol use, and cigarette use is proportionately increasing in people with mental illness, and those with serious mental illness have the greatest impact in terms of drug use in addition to mental illness. And substance use disorder is associated with suicidality. We see here data that shows us that the outcomes for people who did not have substance use disorders versus those with the green bars who do have a substance use disorder. And what you see are much higher rates of thoughts of suicide, plans for suicide, and unfortunately, suicide attempts in people that are adults who have substance use disorders. Substance use disorder is a risk for suicide for many people, and substance use disorders co-occur with major mental illness quite often, as I've just shown you. It's very important that when we assess people with either mental or substance use disorders, that we assess for all of these conditions because they so frequently co-occur, and when they do, they can place people at risk for suicide and potentially death. And we continue to see not only high prevalence of mental and substance use disorders, but huge treatment gaps in our country. Here I'm showing you data that we have been showing every year for the last few years, showing that only about 10% of people with substance use disorders will get treatment for those disorders. Over 55% of people with mental illnesses get no treatment. Nearly 35% of people with serious mental illness get no treatment. People with co-occurring substance use disorders and mental illnesses. What I've just shown you can be such a recipe for very, very severe effects on one's health. Only about 10% of people get treatment. And for our youth, our adolescents with major depression, over 56% are not getting treatment. But treatment gaps, bad enough, but it's not the only problem. Here are the locations where substance use treatment was received. I think it's worth noting that the greatest number of people got treatment in a self-help group, with diminishing numbers for outpatient services and relatively few people getting inpatient services, hospital services, emergency services related to their substance use disorder. And yet we have over 19 million Americans with substance use disorder. We really must find a way to engage those folks in care and help them to get to a place where they can lead healthy, satisfying, productive lives. It's really very important that we look at this data and think about how we might better help Americans living with these conditions, because there's an awful lot of people with substance use disorders who are not getting care. And when we look at people who, according to NSDUH, have both serious mental illness and a substance use disorder, here's what the data tell us. This is a graph showing that 2/3 of people, these are people who are diagnosed with a mental disorder and a substance use disorder, 2/3 of them only got treatment for one condition. Over 33% of them got no treatment. And only 12.7% got treatment for co-occurring disorders. I really want to just reinforce that treating one condition will not treat the other condition. We must treat all of the issues, all of the health conditions that a person brings to treatment, the treatment setting. It's very important to them getting a good outcome clinically and being able to regain their health and live a life of recovery. We must ask people with substance use disorders about all of their substance use. We must ask them about mental health issues. And for people who come in the door of a mental health treatment program, we must be prepared to ask about substance use and to treat those substance use disorders. It's really time that in our system of behavioral health care, all facilities be prepared to provide services for all mental and substance use disorders that an individual has. To do otherwise is to not provide them the best care. So to summarize, serious mental illness unfortunately significantly increased in adults between the ages of 18 and 49 years old in as little as a year, and we're seeing year over year substantial increases in the numbers with serious mental illness. Major depressive episode significantly increased in all age groups except for people over the age of 50 between 2018 and 2019. Major depressive episode with severe impairment significantly increased in adolescents and young adults between 2018 and 2019. Suicidal thoughts and behaviors significantly increased in adults that were aged 18 to 49 years of age. And that was over a 10-year span of time. So this is a problem that is increasing significantly with every year. We see co-occurring substance use and mental disorders are quite common. Adolescents have significantly increased rates of major depression and substance use, and significant increases in mental disorders and substance use disorders are seen in adults between the ages of 18 and 49. Adults with substance use disorder have significantly higher rates of suicidal thoughts and behaviors than do people that do not have these conditions. And despite modest gains, we continue to see the large gap in treatment need. And we see those who do get treatment are not getting treatment for co-occurring disorders. And most with co-occurring disorders are getting treatment for either one disorder or no treatment at all. So I think the NSDUH really shows us the path forward and what we need to be doing to best help Americans with mental and substance use disorders. 2019 has been a year of some progress, but we still have major concerns. The NSDUH reveals areas where we need to continue to focus. We will continue to address the ongoing opioid epidemic. We want to increase the gains that we've seen. We're very pleased with the gains that NSDUH is showing us, but there is far more work to be done. Marijuana use significantly increasing in adults 26 and older, and marijuana use disorder significantly increasing in adolescents. Hallucinogen LSD use significantly increasing in teenagers. Rising year-over-year serious mental illness in adults 18 to 49. Rising year-over-year major depression in all age groups with increased suicidality. We see that polysubstance use is pervasive among substance users, and substance use and mental disorders are closely linked. And that severe mental illness is a risk factor for hazardous alcohol use and for illicit substance use. So the needs in behavioral health are underscored by these findings. We must continue our ongoing efforts in prevention of substance use disorders. We need to improve substance use treatment rates and treatment for youth and adults with mental illness. And we really need to do this in the context of the recognition of co-occurring disorders. And we must always be thinking about the fact that co-occurring disorders are common, and we should be screening for them and providing care for them. So how does NSDUH fit with the behavioral health needs nationwide? As I told you earlier, NSDUH is a household survey, so it doesn't capture populations that can have very substantial mental health and substance use needs. These are institutionalized populations, people who are incarcerated, people who are hospitalized, people who are living in nursing homes, people who are unsheltered homeless. And, of course, NSDUH does not capture any information on our children under the age of 12. And I've shown you what I hope you'll agree are very significant concerns for certain substance use and for mental illness and serious mental illness. And this is 2019 data. And our 2019 data is all pre-COVID-19, all before this virus hit. So I want to take just a few minutes to finish up and talk about COVID-19. Because COVID-19 has really brought very serious negative consequences to millions of Americans who have great fear of illness and death from this virus. They fear resuming normal life activities because they're concerned about becoming infected with the virus. People are neglecting their own health care, their mental health needs, for fear of becoming infected if they go to see their healthcare provider. We've seen a loss of familiar daily structures. This can be very disorienting to people, and it can result in mental health issues as well as substance use issues, as people have been increasingly trapped in their homes due to restrictions that have been put in place to try to combat a virus. It's led to isolation, and it's led to new expectations for millions of people who have their children at home with them 24/7 now. Parents have been expected to become at-home teachers. For many parents, this is not easy to do if they can do it at all. Unemployment is a huge issue for millions of people. They've lost their jobs, and a large number of them will not get their jobs back as businesses struggle and some close permanently. And then there's the stress of trying to find employment and financial stressors as one's savings get depleted over time. There's the inability to get medical care and follow-up because such care has been deemed non-essential in many areas. Medical care is essential. We need to really be paying attention to the needs of Americans outside of simply thinking about a virus. We must think about the virus. We must put safety measures in place. I'll speak about that in a moment. But we must also recognize that medical care, care for mental and substance use disorders, this is essential care. And we are hearing increasingly about domestic violence and child abuse and neglect. It underscores the fact that for millions of Americans, home is not safe. And we can expect substantial increases in substance use disorders, mental illnesses, and suicidality in all age groups going forward. And we're already seeing the negative mental health effects of COVID. I'm focusing on this because we are already seeing evidence of the devastation that is going to be that of COVID-19. At SAMHSA, we fund something called the Disaster Distress Helpline, and we have seen a 1,000% increase in calls to this helpline relative to a year ago. We've seen increases in the proportion of emergency department visits related to suicide attempts in April and May relative to that same time period in 2019. We've seen decreases in those suicide attempts as stay-at-home orders lifted and America began to open up, which tells you something about just how awful the isolation of stay-at-home orders are. We've seen increases in calls to domestic violence hotlines, reports of child abuse, and increasing infant deaths that have been attributed to injuries related to child abuse in recent months. Increases in suicides in some areas, increases in opioid overdose deaths in some areas. I just told you about CDC telling us that there was an increase in opioid overdose deaths in 2019. Well, I will tell you that during COVID, some parts of our country are seeing increases over the 2019 numbers, 25 to 50% over similar numbers, similar data from 2019. And we know that in some areas, first responders have been concerned about administering nasal naloxone in a case of an overdose because of concern about COVID. We've done a lot of work to try to provide technical assistance and assistance to first responders to help with that. Emergency housing is in very short supply now for those leaving psychiatric hospitalizations because in some areas, much of that housing has been converted to COVID quarantine space, which relegates are people with serious mental illness coming out of hospitals to the streets. We see the layoff of behavioral health staff and providers who don't have financial reserves that can help them to survive this extended period of downturn and who are unable to generate enough revenue to survive. This is very worrisome because we need more in the way of mental health and substance use disorder services, not less. All of these things predict major increases in mental and substance use disorder treatment needs, recovery service needs, and this in the face of a potential loss of staff and services to assist our people with these issues. I think it's worth saying, I don't hear it said very often, but I think it's worth saying that the costs of untreated mental and substance use disorders are quite large. This is data that says that the cost of untreated serious mental illness is $300 billion a year. And NIDA tells us that the cost of untreated drug and alcohol abuse, $600 billion a year, nearly $1 trillion in yearly costs. And this is not 2019 data. This is older data that we could easily expect those costs to be higher than that. But nearly $1 trillion in costs. And that says nothing about the devastation of American lives in terms of lost productivity, unemployment, disability, healthcare costs, and criminal justice costs. All of these burdens we can expect to increase with the additional stresses that have been placed on our people by COVID-19. So what can we do now? At SAMHSA, we have to use our resources to the greatest benefit possible. We need to make sure as many Americans as we can possibly help get that help, and we will be working very hard to do that. I'm very grateful to SAMHSA leadership and SAMHSA staff who I can tell you have worked very hard during these difficult times to make sure that resources from SAMHSA are getting to our communities just as quickly as possible. Community-based treatment and recovery services are really the key, and I think we should build on the Certified Community Behavioral Health Clinic model, which provides crisis intervention services, suicide prevention resources. These programs integrate mental health care, substance use disorder treatment, and general medical services. It makes it easy for people to get all their needs met in one setting. And children's mental health services have strong linkages with schools. I very much hope that schools will be able to safely reopen in the fall. I think it's important to say that no one would ever expect a school to open without their leadership having come together with parents to determine how and when a school can safely open. But I will tell you that it's very important that this happen because children must get educated and they need time with their teachers and with their peers. It's education, it's social development, it's nutrition for millions of American children. And for many, it's special services. We have millions of children with special needs, and they get those services in the schools. Speech therapy, occupational therapy, other types of services. These children are getting nothing right now. And so it's very important that we look at how we can do this safely. We need to keep telemedicine and telehealth in place, including use of the telephone. I've been a strong advocate for that, where audiovisual isn't possible. And for millions of American households, they either can't afford internet services or they don't have access to broadband services. And so we must keep those telephone-based services in place as well. It's a very important area to make sure that Americans can get some care. But we also need to make sure that these services are paid for so that there is not a reduction in reimbursement to providers because it's a telemedicine service. This is important to make sure we can keep that resource available. We need to expand technical assistance and training to our behavioral health providers, to clinicians, to our peers who are doing such important work in our communities. And SAMHSA has asked all of its technology transfer centers to make technical assistance and training available to put telemedicine and telehealth in place. That's gone very well. We've received a lot of positive feedback. We will keep working with our communities and our providers on making services available to Americans. But we have to think outside the box. We have to address safety issues related to COVID-19. We need to put in place social distancing. Masks need to become the norm. And providers should be ordering and storing PPE so that people can get the care and services they need. We need to bring behavioral health staff back to face-to-face service provision. And to do that, we may need to do things differently. We may need to expand hours. We may need to have programs on evenings and weekends because we have smaller numbers in our programs at one time so that we can do it safely, so that we can observe social distancing. But I would really urge all providers to think this through. How can we do this so that we have not only telehealth services, but those essential face-to-face supportive services that are so important to our people living with serious mental illness and substance use disorders? People aren't going to come back to our programs unless patients and families feel confident that their loved ones can get those services safely. And so it's very important that we think this through and that we diligently put these practices in place. But we must put them in place because it's so important to the health of our people. So let's work as hard as we can to help decision makers understand that mental health and substance use needs in America pre and post-COVID are great, and we need resources to address them. Let's keep the virus in mind in planning and implementing our services so that we make sure that we have systems in place that safely deliver care. But what we cannot and should not do is to ignore the overall health needs of the American people. That's really, from my perspective, that should not be an option. We really need to balance safety and our understanding of how to address COVID-19, but we must do it from the perspective of there are many mental health, substance use, and general medical needs that our people have, and we must make it possible for people to get care for all of those conditions. We need to work to restore our systems. Our mental health and substance use disorder services are essential services. They need to be widely available to all who need them, and they need to be available in a face-to-face setting. We need to expand our treatment and community recovery support systems permanently, and we need to acknowledge that every American life is precious, and every American death, regardless of the cause, is a terrible loss. I want to thank everyone for their attention today. I hope that the data that I've presented from the 2019 National Survey on Drug Use and Health is informative, gives you information to think about as you think through your situation in terms of mental health, in terms of addressing substance use, and in terms of meeting the needs of our people. Thank you very much.